Thank you, Giles. So we now move on to item 4 on the agenda, which is public involvement. We have a deputation at today's meeting from a local resident. The clerk will read it out and I will respond to it. Giles, you have 5 minutes to represent this deputation on behalf of the resident.
Thank you. Chairs, members of the board, the independent NHS investigation into WellBN identified actual and potential harm affecting children and young people in Brighton. It examined NHS primary care rather than Brighton and Hove City Council. We fully accept that distinction. However, safeguarding does not operate in organisational silos. Children move between schools, families, youth services, primary care, specialist services and social care. The Health and Wellbeing Board exists precisely because safeguarding and public health depend upon effective partnership working across those boundaries. The question, therefore, is not whether Brighton and Hove City Council was the subject of the investigation. The question is whether the investigation gives rise to any lessons for the Council's own safeguarding responsibilities. Good safeguarding practice requires organisations to learn from serious failings wherever they occur within the local system. It does not require an organisation to accept blame. It does require curiosity. Residents have therefore asked the straightforward governance question: has the Council considered whether any lessons arise for its own safeguarding arrangements, work with schools, external partnerships or commissioning relationships? Over recent months, residents have raised this question through correspondence with the Chief Executive, through the Health Overview and Scrutiny Committee, through the People Overview and Scrutiny Committee, and at full council. To date, the principal public response has been to emphasise that the WellBN investigation examined NHS services rather than council services. Whilst factually correct, that does not answer the question being asked. No resident has suggested that the Council was the subject of the investigation. Rather, residents seek reassurance that the Council has reflected on whether any aspect of its own policies, guidance, partnership working or safeguarding governance should now be reviewed in light of what has been established. This is particularly important because concerns about safeguarding, social transition, external providers and evidence standards have been raised publicly by parents and residents over a number of years. Some of those concerns were dismissed at the time. The WellBN investigation demonstrates why safeguarding systems should remain open to challenge and willing to examine uncomfortable questions. PSHEbrighton therefore asks the Health and Wellbeing Board: 1. What process has been undertaken to identify any organisational learning arising from the WellBN investigation for Brighton and Hove City Council and its safeguarding partners? And 2, if no such review has been undertaken, will the board now commission or support one? This is not a request to revisit political debates. It is a request to demonstrate the principles that underpin effective safeguarding: curiosity, transparency, partnership working and organisational learning. Public confidence is strengthened not when institutions insist that failures happened elsewhere, but when they show they are prepared to ask whether those failures reveal lessons for themselves.
Thank you, Giles. Thanks to the resident for that deputation, and here is the response that we have prepared for them. The Council is aware of the shortcomings identified in NHS England and NHS Surrey and Sussex Review. The Council's Health and Overview and Scrutiny Committee, also known as HOSC, is a correct forum for issues of primary care quality, and I understand that this issue will be considered for a future HOSC meeting. There is no evidence to suggest that there are systemic safeguarding failings within the Council, but as always, the Council is keen to hear from families directly should they have specific issues they would like to raise with us regarding their individual experiences. Is the board happy to note this deputation? Thank you. It will be noted.